Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Brittany Bond with Helping Hands. Welcome, Brittany.
Thank you for having me.
I'm glad you're here. Before we started taping, I was like, it's been a while since I've done this. So I'm glad it's you in the guest chair.
We've missed a month or so, but we usually get together. I'm glad to be here today.
So tell us, what's going on at Helping Hands?
Well, quite a bit, actually.
Good.
We've hit the ground running this year in 2024, and a lot of what we're doing is focused around Medicaid expansion, which happened and it started on December 1st. 600,000 North Carolinians became eligible for Medicaid. It's completely based on income now, and that is, it sort of changes things for some of the patients in our patient population. They now have access to Medicaid, which is a great thing. So we have been spending a lot of our time helping folks with that transition, navigating the pathways to get access to their benefit and finding new providers. So we also have been working to connect with the, I think 600,000 North Carolinians got access to Medicaid, but there are still 700,000 North Carolinians who are still uninsured and still are not eligible for Medicaid. And that's about, a little over half of the population that's total uninsured in the state. And it's about the same in Caldwell County. So about half of the uninsured folks in the community are still not eligible for Medicaid. So we're looking at ways to connect with those folks and let them know how we can help them with their health care.
So making the transition and still helping the population that you can. It's just defined a little differently financially now. Is the only difference.
Yeah. So we just have a population of folks who now have access to that benefit. But again, half of the uninsured folks in Caldwell County are still financially eligible for our services. And a lot of those folks are, it's our working adult population who either doesn't have access to insurance at their job or maybe has access to it but can't afford it because, insurance, our rates just keep going up. That's something that we see. So at Helping Hands, we provide, free primary care. We have 2 med-level providers who are there, and we're just a doctor's office like any other doctor's office. And then we also have pharmacy services, plus a lot of other ancillary opportunities for dental care, for mental health, for free eyeglasses and things like that. So those are the things that we can do for our patients, and we just want folks to know that we're here to help them.
And you may kick me under the table for saying this, you're kind of like a healthcare safety net because you're catching those people who can't afford insurance, but don't qualify.
Yes.
For Medicaid or whatever state services are available.
Well, that's exactly what we are. We're a safety net. We often will see patients who have maybe lost their job or in transition from one job to another and don't have insurance or have lost their insurance for one reason or another. And we are, we're kind of the stopgap there so that we can continue to, manage their chronic conditions. To make sure that they are healthy, that they have what they need, and that they have access to a medical provider and to their medications.
And the thing that I have learned about Helping Hands is you're not a one visit and done. You want to be the health home.
Yes.
For the insured.
100%. Our goal is to be the medical home for our patients. We do offer urgent care services, and that's something that, as we see this transition for some of our patients who are going to be moving out and finding a new provider, we're going to have more capacity to be able to offer urgent care visits. And we do those kinds of things for folks. A lot of folks who come and access our free dental program, which we've talked about that before on the show, but it's called Project Smile. And that is for anyone who is uninsured and meets financial eligibility criteria. We have a network of dental providers that will do free care. A lot of it is focused around urgent needs like extractions, but we also have resources for dental hygiene and for restorative work. So, 2 of our big partners in Caldwell County for that are the Caldwell County Health Department, who we've partnered with for years, and they are wonderful to help us with dental care for adults who meet this criteria, and then also Western Carolina Family Dentistry. So they're 2 of our big partners in Caldwell County, and then we partner with other regional free clinics who have resources to make sure that we get patients what they need as quickly as we can.
And I guess we've all learned that your dental health has a big impact on your overall health.
Oh, Oh, yeah, it really does. I mean, having poor dental health can contribute to cardiac issues, can cause so many other problems that people have to deal with. And it's just overall indicative, most of us have more important things, and we don't deal with things like our dental health needs until they're an emergency. And we see folks every day who come to us and it's like, I have an abscess, I have this this tooth that's killing me, and we're able to say, okay, we've got some resources to help you take care of that.
That's a huge help, because I know in our county that has been a need for a very long time.
Yeah, it has been. Like our program, I wasn't with Helping Hands when this happened, but our program was born after the the change in availability of a dental bus that was available in the community. So this was to sort of fill a resource gap that was there. And up until recently, we received some pretty significant funding from Blue Cross Blue Shield through our state free clinic association to create this regional program. So we were incredibly blessed to bring this to Caldwell County and the surrounding counties.
It is a really, really big deal to have that. I want to go back to the Medicaid expansion.
Yeah.
If a patient calls, makes contact with you, and they don't know if they're qualified or not, because let's face it, some of those charts are a little bit confusing.
Oh, yeah, it can be.
Can be a little bit confusing. Walk me through what happens if I called and I was in that situation and maybe I did qualify for the expansion. How would you help me then?
So what we have been doing, and since we found out that expansion was happening in late October, is we're kind of reviewing financial information with potential patients who call us and are interested in enrolling with us. If they're eligible for Medicaid, we walk them through how to access that. You can apply online or you can go to DSS, and we give more detail about kind of how that whole process works. And then, we have been also hosting a representative for Medicaid on site a couple of times a month during this time. And we actually have some appointments coming up on January 29th. So if there is someone out there who's interested in learning more, if they're eligible for Medicaid but they have questions about how it works, if they're not 100% sure about what they're eligible for, they're welcome to give us a call, and we can put them on that schedule to talk with that rep at our site. So.
And that's awesome. I figured you had a plan there. I just thought maybe we should take a look at what that is. If somebody has an emergency, they've not quite gotten the Medicaid in place, can you help them?
We can. So we can help folks with the services that we can provide in our office, and we can navigate them to the healthcare resources that are available for them, depending on when they're eligible. And I'll go ahead and preface that I'm not the expert at our office
Certainly.
about expansion, but there definitely are options for folks if they have an emergency, if they haven't completed their application yet, to get that done. And it, in some cases, can retro back and cover if there's an emergency situation.
Right. So there are options.
Yes, definitely.
And I guess that's what I'm asking for, folks.
Yeah.
How are there, there are options. We just need to reach out.
Oh, yeah.
And find out what those are.
Yes, and we have been, we've tried to be really proactive in helping to navigate folks so that if we aren't the right resource for them, where can we send them? That's something that's always been important at Helping Hands, but definitely now. And also, keeping in touch with our, community partners at DSS, at Caldwell Memorial Hospital, with all of our, sort of healthcare arena partners to make sure that we're helping folks access what they can and to get care in a timely manner.
That's great. As I was sitting here thinking, I know we're jumping around a lot today, but this is as questions pop into my head. So if you're watching, this is how it works in my head. So please forgive me. Back to being a medical home. When we think about that, talk about the types of things you help treat, and also a little bit about your pharmacy and how that all works together.
Yeah. So right now, the majority of our patients are living with some kind of chronic illness, whether that be, hypertension, cholesterol issues, diabetes, that kind of thing. So, we manage those needs for our patients. We do their follow-up visits. We do their annual wellness visits. And we just help to manage their overall health. And part of that, of course, is accessing medication that you need, particularly if you're living with a chronic condition. We have seen kind of a trend in our patients that we're seeing fewer folks who are dealing with active chronic illness who have been enrolling, which I'm really excited about, because that means that we're catching people, before there's a crisis, before there's an issue, and we can help them maintain health. And that's a wonderful thing for our patients and for our community. So that's the trend that I've seen that I hope we continue to see. I mean, like, we're gonna help you no matter what your healthcare needs are, as long as it's within our scope. But speaking of our scope, there are some things. We have 2 mid-level providers who see patients on site at the clinic right now. So
I'm going to stop you. I know some people will be familiar with the term mid-level provider,
yes. Mm-hmm.
but help me understand what that is.
Yeah, so that is someone who's not an MD or a DO. So someone who is a nurse practitioner. Like our mid-level providers we have 1 nurse practitioner and 1 physician's assistant. So they work under the supervision of a physician. And and our medical director is Dr. Brad Kristoff. He's great. But our providers are wonderful, but there are some things that are a little outside of their scope of practice. The example I always like to give is someone with type 1 diabetes that just requires a little bit higher level of management than we can offer in the clinic. And so what we do is we partner with the physicians in the community, like Dr. Kristoff and some others, mm-hmm. who see our patients through what we call our access program. So you can be a Helping Hands patient. If you have a need that's outside of what we can manage in the clinic, you can see a physician in the community through the partnership that we have, particularly with UNC Charity Care. So all patients who come to Helping Hands who are enrolled in our services are duly enrolled in Charity Care. So that way, services we can't offer on site at the clinic, you can access through UNC for a really low rate. So, but that is something that we can offer to those patients. So yes, you can still be a Helping Hands patient. You'll see the doctor off site. You can still get your medications through us, which are for free, and you can still access all of our other services as well. So, but that's the thing. So, but our goal is for our patients to be their primary medical home, to help them with their wellness, to help them improve their health over time, and then to help them access those medications. Mm-hmm.
All of this doesn't come for free.
No.
I mean, while you're very volunteer minded, mm-hmm. you have a staff and they're paid. I mean, to be there every day.
Yes.
So, how do you fund Helping Hands?
So Helping Hands Clinic is completely privately funded. We have been the very grateful recipients this year of an allocation from the state budget that was for free clinics, and that was a wonderful thing and has been a wonderful boon for our organization. But we also are incredibly well supported by this community and by the local foundations, by local individuals, and then our patients, as they're able, also make donations to support their care. So that's primarily how we're funded. It's pretty amazing what we can do with the love and support of the people in this community.
Speaking of love and support and funding, mm-hmm. March is a big month for you.
It is a big month for us.
Tell us what happens in March with Helping Hands.
So in March, we have our annual Pot of Gold fundraiser. This is one of the most fun things that we do all year. This is our big annual fundraising event. It is centered around the Pot of Gold, which is a $5,000 raffle grand prize. So over the next couple of months, folks will be seeing, raffle tickets for sale, event tickets for sale. This year it's going to be on Friday, March 15th from 6 to 8 o'clock at the Broy Hill Civic Center. So it's going to be a ton of fun. We're going to have a St. Patrick's Day themed costume contest. We're going to have a cake auction, which last year I wish I could have taken home all the cakes, but sadly I was outbid.
Sadly, it's not the way it works.
It's not the way it goes. But it is so much fun, and that raffle prize, that is so exciting. So we have the $5,000 grand prize. We have a second and third prize. We'll announce those as we get a little closer to the event. But it's really fun, and I hope that folks, if they can't come to the event, will at least buy some raffle tickets and have a chance at winning that $5,000.
So you don't have to be present to win the $5,000.
You do not. We hope you're there. It's a whole lot more fun when you're there. But if you're not, we certainly we're gonna have that available for you.
So go ahead and mark your calendars for March 15th.
Yes. Mm-hmm.
We want to go ahead and get that date out there. I know we've got a little bit of time, but
oh yeah,
it'll be here soon.
Oh yeah, and we'll be shouting it from the rooftops too. So
I'm sure you'll come back and talk to us more about the event. And
we'll talk more about it in
sponsors
February.
And all those kinds of things.
Oh yes, it's going to be really fun. So.
Brittany, we've covered a lot today about the clinic, but what have we forgotten? What's is there something that we need to talk about? The January 29th event, let's mention that again.
Yes, so that is an opportunity where we're going to have a Medicaid representative on site at the clinic. If anyone in the community, it doesn't have to be someone who's a Helping Hands patient, but has questions about Medicaid, about expansion, about their eligibility, they can reach out to us and schedule a time to talk to that representative. And then also we are looking right now for folks who would be willing to donate wish list items, particularly cough medication right now. So, Mucinex, Mucinex D, Dayquil, NyQuil, Coricidin for our folks who have high blood pressure, cough drops. Those kinds of things are in demand at the clinic. And if someone has a heart to support us and help our patients, that would be a wonderful thing to let us share with our patients.
So what else besides cough medications on your list? And where can people find your list?
So our list is on our website. Or they are welcome to give us a call and ask us. A couple of other things that we do need. We're an organization. We have office supply support needs. We use a lot of copy paper, so that's something we get a wonderful, generous donation every month from Anything Office. But that's something that we always could use more of. And then I know another thing that my staff just told me we needed today are batteries. So we need AA and AAA batteries. If there's anybody out there who's willing, you can drop them by the clinic. You can call us. We'll see about coordinating a pickup. But we're really grateful for anything that anybody is able to help us with.
Speaking of dropping things by the clinic, you are really conveniently located.
Yes, we are.
Give people your address, just for people who might not know.
We are at 810 Harper Avenue, and we are very conveniently located. We have a great parking right across the street from us, and that's the location of our clinic and pharmacy where, we're all in one building, and the entrances are right next door to each other. We're right beside Wolf Moon Salt Cave, so it's a fun place to be downtown, so we're glad to be there.
Brittany, thank you for being here today and sharing more about Helping Hands.
Thank you so much for having me. I really appreciate it.
And thank you for watching Caldwell County Today.